Hi, thank you for clicking on my video. I hope you enjoy it. I actually filmed this video about a year ago and I've just not been well enough to edit it up until now. So I really hope you enjoy it and let's go.
Hi, I'm Eliza. Welcome back to my channel, or hello if you're new here. So for those of you who don't know, I talk about chronic illness and disabilities. And today we're going to be talking about a 72-hour heart monitoring device. In the UK, this service is provided by the NHS, and what happens is you get referred by your GP or a specialist, and you get put on a waiting list, which can vary from between 1 month to 3 months, sometimes shorter, sometimes longer. And depending on how long they want you to have it on, you can have it on for 72 hours, 3 days, or longer or shorter. So the purpose of this video is basically to go through what it's like having a heart monitor put on and to try and alleviate any anxiety or stress someone might be having because of this, or if they're just interested in the whole process. Because I know from my personal experience, I was very, very nervous before I got it put on. And I did try to find a few videos that spoke about that, but the majority of them were like a day in the life of having a heart monitor on. And while those are incredibly useful, and I think definitely go have a look at them if you're interested, I'll link some below, which I found really interesting to have a look at. I think that talking about why they're put on and the whole sort of experience at the doctors as you're getting it put on, and speaking about the whole nervousness or anxiousness about it is, well, I hope will help somebody feel less scared about it and less alone. So the reason why I decided to do this video is because I actually got one put on today. So I thought, well, it's fresh in my mind and, you know, it's not all been flooped out. I could explain the whole process to you. So what happens is you go into the hospital to the area that it is at, and it will say on your letter where you have to go. But you go in, you sign in, you wait in the waiting room for your name to be called. They'll take you in and they'll sit you on the bed and they'll explain everything to you. If you have any questions, you can ask them. They're all really, really lovely and really nice. So you get sat on the bed, they wipe down the areas that the stickers are going on to, and they'll talk you through everything they're doing. And you may have to take off some layers of clothing depending on what you're wearing, but I wore a vest top for mine and she just worked around it. So it was really nice. She was a really lovely lady and she talked me through it and it really alleviated my nerves. And for those of you, well, I mean, none of you know, but I have anxiety, OCD, and depression, which I have help for. I am on medication for. That's not the main premise of this video. I don't want to talk about that. But I know from experience, people with OCD, we really, really struggle with when we don't know if something's been cleaned. So the NHS are very good at cleaning all equipment before they give it to the next person. So they, you know, when you give it back, it gets cleaned before the next person gets it. But what I did is I gave it a little wipe down when I got home with an anti-bac wipe, and now I feel fine. And being told that I'm allowed to shower with it on is brilliant, because these bits here disconnect and you take them all off, you leave the device here out of the bathroom as far away from water as possible because you cannot get it wet, and then you can shower with these stickers on. And they do give you spare stickers in case they come off. I'll show you the heart monitoring device now, so bear with me because it's a little bit fiddly with all the wires. So you have 2 electrodes here, which as you can see are connected to this device, which tells the time, which is quite handy. So, 1:29 today. So this is what records everything. You do not touch the yellow button, but when you feel some kind of symptom, you press the green button and then you have to record it on a piece of paper. And then you return the piece of paper when you go back on the date they give you. And so you've got 2 electrodes here, like I was saying, and then there's a third one here. So it's all actually quite nice. But this is the device that records everything on. So this button is for the NHS person only, the doctor, the nurse, whoever. And then this button you press when you're having some kind of symptom, whether that be you can feel your heart's going really, really fast. You write that down on a piece of paper that they give you. Just to clarify, not a random piece of paper. That would be bad. But you press this button and you write down what's going on. So if your heart's going really fast, you write that. You write down the time, what activity you were doing, because your heart might just be going fast because you've ran up a set of stairs, and that's normal. But if it's just you stood up from sitting down, that's not normal. So you press the little green button and it'll be recorded, it'll be flagged up for when they look at the results. And other symptoms, obviously, so dizziness, that's a really bad one, because that, well, not a really bad one, but that can mean low blood pressure as well as your heart either going really high or really low. So you click the button for that as well, and you record it on the piece of paper. So it's very straightforward, but it's quite nerve-wracking. Right, to access this service, you obviously have to have some kind of heart issue going on. But basically, if you have some kind of heart problem, like whether that be it beating too fast, too slow, and you mention this to your doctor, they might see fit to refer you to a 72-hour heart monitoring service thing. Or, well, in my case, what happened was I went to see a rheumatologist about my ongoing health problems, and she diagnosed me with a chronic condition, and some of the symptoms I was having didn't fit into that category. So she's concerned that I have another chronic condition alongside that. And I mentioned how my heartbeat changes quite a lot, so it will fluctuate. So what happens is I get mild tachycardia, which means your heartbeat goes over 100, which is healthy when you're exercising, but it's not great when you literally just stand up and then it just shoots up from a nice resting rate of like 65 up to like 130. That's not healthy. So that's why I've been referred to this service, and that's why I've got this on for the next 3 days. But basically, they'll refer you if they think it's necessary, or they might give you an EKG, which is a short one that's a lot more cables, but you only have it on for like 10-20 minutes, and it just records your heartbeat and it'll show if there are any abnormalities in that short span. But because with obviously hearts are very complicated, and in my case it doesn't happen constantly, it just happens a few times a day, which isn't ideal because it can make you feel really faint or dizzy or lightheaded and all of that lovely stuff. But basically, if they feel like it would benefit them into getting to the bottom of what's going on with you, to refer you to this service, then they'll refer you to this service. And like I said before, and I've probably said this so many times, it's just, it's not as stressful as you think it's going to be. I know I was absolutely bricking myself earlier beforehand, but it wasn't worth the stress. That was a lot of wasted energy. So after the 72-hour period, or how many hours you have it on for, is up, you return it back to where they tell you to. So in my case, the hospital. And my instructions were to take all of it off at home first, so it's easier for the collection to be done. And how they know it's mine is because the NHS lady, she recorded my patient number and name and the doctor who referred me on this little device thingy. And so, you know, it will all be analysed by specialists in the cardiovascular area. I'm not entirely sure what their exact title is. Maybe I should have Googled that, but I do know that they know what they're doing. So it will all get analysed and sent to the doctor who referred you, and then you'll get your results back. If on your written record of when you've pressed the little green button, or whatever colour your button is, they such as dizziness or heart pain or something like that, they might want to talk to you on the day just to check what you mean by that, and they might want to do further testing on the day, so potentially an EKG. Getting your results back should take around about a month, obviously depending on how many patients' results they've got to analyse, among other factors such as second opinions potentially, or if, you know, there's a strike or if people are off sick. You know, there are all sorts of factors, but at the end of the day, when it's analysed, it'll get sent to your doctors or whoever referred you, and then you'll get your results back. So, in conclusion to this whole process, heart health is incredibly important. Yeah, I'm looking at you. If you have a heart problem or you feel there is something wrong with your heart, talk to your healthcare provider, because at the end of the day, your heart is incredibly important. And just like anything else, it can get injured because it's a muscle. So if you've, you know, strained your arm muscle or something, you go to the doctors about it and they'll refer you on to physiotherapy. It's like that, except you get referred to some kind of cardiology thing because they specialize with hearts. So the key thing to take away from this is it's not that stressful of a process, and you can wipe down these things with antibac wipes. You just can't get them wet. That's the main thing. And if you feel like you're having some kind of heart issue, go talk to your doctor, your GP, whoever, your healthcare provider, because they'll be able to refer you to who they think you need to see, or they'll be able to do tests in their office then and there. Obviously, if you get referred to a 72-hour heart monitoring thing, then I've got you covered. I'm your girl to go to for this. Obviously, I'm assuming if you're having a 72-hour heart monitor, that's probably why you've clicked on this video. I want you to take away from this video, double takeaway, is that it's not anything to be really, really worried about. Obviously, you can't help but feel nervous or stressed, but I'm really hoping that this video will help to alleviate some of those worries, because it's not as bad as you envision it to be in your head. If you need more information on this topic, obviously consult your healthcare provider, because like I keep saying, I'm not an expert in this. I'm just talking from my personal experience. I do not have a degree in medicine. I don't have any degree, you know. I'm just talking about my personal experience. So if you feel like you need one of these, talk to your healthcare provider. Thank you so much for watching. It's greatly appreciated. Please press the like and subscribe button and turn on all post notifications so you can be one of the first to see any new videos I come out with. And goodbye for now from me and Bracken. You can also follow me on any social media. I will put them somewhere on here. Yeah, thank you so much for watching. Bye.